Okay, let's start off with the second unit. Okay, the second unit is occupational hazard safety measures. So, what do you understand by this term, occupational hazards?
Um,
Anybody?
Ma'am, any risks which can occur in the place of work in
Very
their
good. So,
occupation?
any risk or any injury that occurs in the place of work. And can you give me an example?
Like
Spillage
in
of water, ma'am.
mm,
Sorry.
Spillage of any liquid and skidding.
Okay, spillage of any kind of chemicals. Okay, then.
ma'am, COVID is a direct example.
Sorry.
COVID, ma'am.
COVID. Very good.
Yes,
COVID, because you get exposed to the infected person.
exposed to the.
Yes, yes. Okay. So let's start off with the introduction. And occupational hazard is a hazard experienced in the workplace, as you all said. Occupational hazard is a condition that results from exposure in a workplace to a physical, chemical, or biological agent to the extent that a normal physiological mechanisms are affected and the health of the worker is impaired. So before diving into the topic completely, I'll give you an example. Okay, so this was a research study done on street sweepers. Okay, so street sweepers are the people who work extensively, though the duration of hours is less, but the workload or the work pressure or the extension of work is very much. And when they work, so many of you, not many of you, all of you might have seen no street sweepers working, right? So what is the most observable thing, or what is the thing that you have observed in street sweepers?
They use their saris as masks, ma'am.
They use
Their saris as masks.
they use their saris as mask, and they don't use any kind of PPE. Okay, then that is the only thing you observe.
They try to use long sticks instead of the normal broomsticks.
Okay, okay. So is it a good thing or a bad thing?
In a way, they're protecting their back.
In a way, they are protecting their back by using long sticks or the long
Yes.
brooms.
Yes, ma'am.
How can you justify it? Can you tell me?
Because they literally sweep some kilometers together, and if they
Okay,
bend over a period of time on a
okay,
daily basis, then
okay.
they're prone to more injuries.
True, but do you feel that using that long broom, whatever they use for sweeping, are they doing it in a proper way? Are they maintaining a proper posture?
Not really, but it's the better evil than the other one, the other option.
Okay, better than the shorter one, but
Yes.
they don't know the proper way of using these long brooms, because they continuously sweep for kilometers together. They continuously sweep for a longer period of time. Either they stand continuously by maintaining an inappropriate posture, and the third important thing is they don't know the technique of using a long broom. They feel that it is comfortable, but actually there is a method of using it. So what happens is, when a proper body posture is not maintained, it means the person is landing up into one or the other trouble, either directly or indirectly. So the research study which was done on street sweepers was to assess the level of MSD. Any idea about MSD? No. So MSD is nothing but musculoskeletal disorders. So musculoskeletal disorders are seen in people who do work for a very extensive period of time, or the people who uh, do work which includes heavy lifting, or standing for a longer time, sitting for a longer time. Now, so such people land up into uh, developing musculoskeletal disorders. So this research study, which was done on street sweepers, gave a result. So the final result, when we have assessed about the level of musculoskeletal disorder, it stated that among the hundreds, among the 100 samples taken, 89% of the samples were at risk of developing musculoskeletal disorders because of not maintaining proper posture, not using PPEs, getting exposed to hazardous materials, at risk of especially osteomalacia, osteoporosis, and arthralgia. Okay, so this example I have given you so that whenever I talk about occupational hazard, this thing should come into your mind so that you can correlate. Okay, so I'm not going to repeat the example again and again. I have given you a scenario. Just try to fit into the concept. Okay, according to WHO estimate, there are 59.8 million healthcare workers worldwide. About two-thirds of them, that is 3.9 million, provide health services, and one-third, that is 19.8 million, are management and support workers. So both are at equal risk of developing or falling, what you call, are at risk of developing occupational hazards. But the people who are exposed to hazardous areas are much than people who are very less exposed. So occupational hazards, the actual meaning and concept is, a hazard is a undesirable, unpleasant event or danger. It can also mean risk. An occupational hazard is a risk peculiar to the specific occupation or place of employment that arises in normal work at such a job or workplace. Again, the same thing. Whatever hazard that takes place in the workplace is called as occupational hazard. It includes accidental injuries and diseases, and it is a term that signifies both long-term and short-term risks associated with workplace environment, and is a field of study within occupational safety and public health. So as I have given you example, if people do it, if the street sweepers are continuously maintaining inappropriate procedure, they're not using PPE, they are getting exposed to hazardous material, yes, they will end up into long term diseases. Wherein if you identify them priorly, you can make sure that they don't land up into complications, and you resolve all the errors at prior hand. Next is, common hazards are risks in healthcare and hospitals. Especially the common hazards that are seen in the healthcare and hospital settings are, lifting, supporting, and moving patients. So this takes much effort. And if it is not done properly, either the patient or the staff will land up into the problem. Moving and handling equipment such as wheelchairs and trolleys, work-related stress, occupational violence, slips, trips, and falls, bullying, and harassment. I hope this is no, very much self-explanatory, and I needn't explain you about it. Please look into the slide again, and I'll read out all the 6 points again for you. These are the common hazards that are seen in the hospital settings or the healthcare settings. First one is lifting, supporting, and moving of patients, moving and handling equipment such as wheelchairs and trolleys, work-related stress, occupational violence, slips, trips and falls, bullying, and harassment. Next one is occupational hazard in different areas of hospital. So in different areas of hospital, when we talk about, it is about different units of hospital, be it ICUs, be it medical surgical units, be it uh, pediatric units. Every unit has its own uh, level of causing hazard, or own risks of causing hazard to people exposed to it. So some of the occupational hazards in different areas of hospital are CSSD. So this is the central sterilization unit, wherein the department takes control of getting all the surgical kits and all the equipments from the hospital, and they sterilize all the equipments at a degree of temperature in you know larger machinery, and make sure that when the equipment is exposed to certain kind of temperature, all the microorganisms are killed, and then it is ready for reuse, and there is very much less chances of contaminating infections from person to person. And this occupational hazards in CSSD are again categorized into different types, that is biological agents, chemical agents, electricity, non-ionizing radiation, and other hazards. So this CSSD is resolves bacteria, fungi, because it is what you call the equipments are exposed to certain kind of temperature which kills the growth of microorganisms. And also certain chemicals, certain solutions are used to wash the equipment first and then expose it to the heat, and then certain amount of electricity is needed to run that huge machinery, and when running that machinery, people who are in the units are at risk of electrical accidents. And also there is so much radiation that comes out of that huge machinery, wherein people who are exposed to that radiation fall at risk of developing health related problems. Other hazards are nothing but getting exposed to excessive heat, getting burns because of the liquids or the chemicals that are present, getting exposed to the bacteria. So these are the common risks that are seen in the central sterilization department. And then occupational hazards in laundry department. The occupational hazards in laundry department is nothing but because huge uh, amount of clothes which are infected, which are contaminated with multiple organisms. If the handlers who are in the laundry handle it without using PPE, they fall at risk of developing dreadful infections. So the same applies with occupational hazard in laboratories. So people who are lab technicians should be very much vigilant. They should always be in PPE because they come in contact with different kind of fluids, chemicals, etc. And then occupational hazards in radiology department. Radiology department also now they are being provided with special gowns and special kind of kit to protect themselves by getting exposed to the higher radiations in the department. And then occupational hazard in F&B department. F&B is nothing but food and beverage department. So that is a major source wherein nutrition, everything goes to the patient, and if it is contaminated, the whole hospital will fall at risk of developing infections, not only patients but also the staff. Then fire hazards. So fire hazards is nothing but the fire safety. About this fire hazards, I'm not going to discuss over here because we have a complete unit about what is fire safety, how we can prevent fire hazard. I'll discuss about it in detail over there. But generally fire hazards are nothing but making sure every floor and every unit is equipped with fire extinguisher, and there are certain sensors to detect the emergency priorly and to evacuate people. And then equipment hazards is not properly sterilizing the equipments, and not means handling the equipment properly, cross contaminating it and exposing it to an very unhygienic environment. And then hazards related to toxic chemicals. Hazard related to toxic chemicals is nothing but spillage of certain kind of aerosols or liquids. So that is also occupational related hazard. Hazard related to sharps, not disposing the sharps properly, and leaving it at the bedside or leaving it in the open units. When people come in contact, they'll have cuts, bruises, and then a person will land up into one or the other infection. And if it is used, then again it causes a great complication. And then for people who are uh, uh, who have undergone surgeries or who are very much aggressive, slips, trips, and falls take place. That's the reason, even if the patient is healthy, Once an individual who steps into the hospital becomes a patient. That's why never we have to leave the patient alone. Every time the person should be monitored and assisted by one or the other person. Then heat stress. Heat stress is nothing but people getting exposed to certain kind of temperatures in the units, people getting exposed to certain kind of materials that trigger the inner self. And then workplace stress is nothing but the external factors, the pressure of dealing with many patients in a time or at a time, and then to do multitasking multiple times, so that causes workplace stress. And it is an occupational hazard wherein if workplace stress increases, the staff will not be that effective and efficient in delivering care, and they will be only in a rush of completing their duties and stepping out of the wards. Next one is workplace violence at hospital. So workplace violence is a serious issue for health workers, and it leads to many negative consequences. It's generally agreed that healthcare industry is the most susceptible to workplace violence, often at the unruly and disgruntled patients. So workplace violence is nothing but threat for people in the medical field is very much, and it can come from any place, anywhere, and anytime. So it is very much important to be vigilant and to be very much uh, attentive to your patients or to the scenarios that happen around in the hospital. Health workers are at high risk of violence all over the world. Between 8% and 38% of health workers suffer from physical violence at some point in their career. Physical violence is nothing but excessive workload, excessive tasks assigning to one particular staff, reutilizing or burdening her with overwork. So these are the physical violence that most of the medical workers or the health workers complain of. And then while 75% of nearly 25,000 workplace assaults occur annually in healthcare setting, and only 30% of nurses and 26% of emergency department physicians have reported incidents of violence, because emergency department faces a lot of threat, because people walk in an emergency situation, and when a death is declared, so the family cannot take it easily and they become rude, they behave rudely. And also in such situations they are not ready to accept the truth. So many of the medical staff fall as prey to the assault or to the violence that happens in the area. And then several studies have shown that work place violence affects the physical and mental health of healthcare workers and reduces job satisfaction. Obviously, when a staff is overburdened, or when a staff continuously comes across with assaults or violence, the efforts decreases and the job satisfaction is reduced, the performance decreases, and the staff will be least interested in doing activities in providing care to the patient. And a workplace violence can be prevented by five key components, that are management, commitment, and worker participation. Means management should be very much supportive to the staff, and also management should see to it that the subordinates have a good collaboration and cooperation. Worksite analysis and hazard identification, and the expertise staff, whoever is there in the units, should have a good knowledge about analyzing the situation before falling into trouble, and also identification of the hazards that will cause problem to patient as well as the staff, and hazard prevention and control, safety and health training, record keeping, and program evaluation, which are very much self-explanatory. So that were the five components that one should keep in mind to prevent workplace violence. Uh, Next one is biomedical waste management protocols at hospital. So this biomedical waste management, all of you might have known about segregation of waste. Yes or no?
Yes, ma'am.
So can
Yes, ma'am.
anybody tell me the segregation, the bins and the waste segregation process? so you all might have known about color coding bins. So how many colored bins are there? What are the categories? How is the waste segregated?
There are 5 bins, ma'am. 5 colors.
Yes, yes,
Um, Green is for kitchen paper, tissues, water bottles, cans.
yes,
Red is for infected plastics, syringes,
yes.
gloves, and yellow is for infected, soiled,
And
anatomical chemical liquid.
okay, all anatomical
Blue is,
waste. Mm,
yes,
mm.
and blue is for glassware,
Yeah,
antibiotic vials,
yes.
and white is for sharp needles and cut glasses.
Good. Thank you. So you all know about the segregation, and this biomedical waste management is about proper segregation of waste so that people are not exposed to the contaminated needles or any kind of waste that is generated from the hospital. Because if this hazardous material comes in contact with general waste, it causes higher contamination and produces a higher hazardous material, which cannot be rectified by giving a minor or a common treatment to the people who are exposed to it. So biomedical waste is defined as any waste which is generated during the diagnosis, treatment, or immunization of human beings or animals, or in research activities, or in the production of testing of biologicals. So anything that is generated through treatment procedure or through any kind of research activities which is hazardous, and when people come in contact to it, it causes infections and diseases. All individuals exposed to biomedical waste are potentially at risk of being injured or infected. So the people who are highly exposed to biomedical waste are medical staff, patients, both in and out patients, workers in waste disposal facilities, including scavengers, and the general public, and more specifically, the children who directly come in contact with this kind of biomedical waste stuff. Next is, general public can be infected by biomedical waste either directly or indirectly through several routes of contamination. So dumping of biomedical waste in open areas is a practice that can have major adverse effects on the population. So though you do proper segregation, if final disposal is not done properly, then people will land up into problem. So there's a place in Karnataka. So I hope you might have heard about this news, wherein there was a village which was very, very no rich, which had very, very rich agriculture land area, a good fertile soil and everything, but the waste which was generated in the city of Karnataka was dumped nearby to this village. I'm sorry, I'm not remembering the name of the place exactly. So, this area which has good fertile land, people who were very hale and healthy because they were not exposed to, all this pollutants. So when the dumping started there, from a small, what you call, heap of garbage, it became a dump yard, and people started even litting that garbage to reduce the size of the heap. And when they started litting up the garbage and the waste, so there were so many toxic agents, chemicals produced, because it was a mixed waste which was dumped in an open area, and all these toxic agents started mixing up in the environment, and all these microbial agents started deeply getting sunken into the lands, wherein all the water resources and the air, everything got polluted in that particular nearby village. Okay, the total population of that particular village was around 3,000 to 5,000, and people started falling sick, and nobody knew that it was because of that dump yard which was there. And till date, people are not getting cured. They had fallen prey for certain diseases which doesn't even have treatment. So if segregation is done and dumping is not done properly, ultimately it causes a biggest disaster which doesn't have a proper solution. Okay, and segregation is one of the most important steps to successfully manage biomedical waste management. In spite of conducting so many workshops, training no different fraternities regarding segregation of waste, giving announcements, giving ads about segregate the waste in such way, not only in the hospitals but also at the home settings, people are not opting for it, and people who are getting exposed are falling means are developing complications and diseases which are not curable. A recommended way of identifying biomedical waste categories is by sorting the waste into color coded and well labeled bags and containers. As uh, you have answered, somebody has answered right now, sorry I don't know your names. So the color coding, whatever you have said was clear. And the same thing, if color coding and labels are maintained, people will also be aware of where to dispose, how to dispose, and how well that can be sent to a final disposable area. And establish a 3 bin system with appropriate labeling in the healthcare facility. Yes, in the hospitals we follow this 4 to 5 bin 5 bin system, wherein we segregate the waste in 5 different color coded bins with labels. But it is mandatory that at least 3 bin system everybody should follow to segregate their waste, and each bin should be labeled with symbols, and it should have a color coding so that they separate the sharp objects, blunt objects, broken glasses, and any kind of harmful liquids, fluids. And it should also be easy to unload and load, and it should not cause spillage anywhere, and it should not lead to any cross contamination. And most importantly, after dumping, while cleaning, it should also be easy to clean and again to reuse the particular bin, so that we procure it with a bag which can hold all the contaminated articles, and then easily remove it and unload it so that we can use. And also a maximum storage of this contaminated equipment or articles should not exceed more than 24 hours. The quantum of waste generated in India is estimated to be 1 to 2 kg per bed per day in hospital, and 600 grams per day per bed in a clinic. So this much kgs of waste is generated from hospitals. So if you think about 2000 bedded, 1500 bedded hospital, so from one bed, if it is 1 to 2 kg, then think about the whole waste generated from a hospital. So it's very much important that you educate people about segregating it, you train your staff about segregating it properly and disposing it to the final properly. 85% of the hospital waste is non-hazardous, 15% is infectious or hazardous. Mixing of hazardous waste results in contamination and makes the entire waste hazardous. As I said you priorly, if an hazardous waste is there, you try to no you try not to mix it with the general waste. If you start mixing it with this general waste, it means it the general waste becomes more hazardous and will cause more threat to people exposed to it. Next, moving on to the silent features of biomedical waste management. So this rules were formulated in 2018. So this rules were given by the government. So I'll read out the points. Try to understand. If you have any doubts, you can stop me in between. The ambit of the rules has been expanded to include vaccination camps, blood donation camps, surgical camps, or any other healthcare activity. Phase out the use of chlorinated plastic bags, gloves, and blood bags within 2 years. Provide training to all healthcare workers and immunize all healthcare workers regularly. Establish a barcode system for bags or containers containing biomedical waste for disposal. The new rules prescribe more stringent standards for incinerator to reduce the emission of pollutants in environment. So when we talk about these features that were launched by the government, and certain protocols that are made by the hospitals on their own, is purely to prevent contamination and to make people not to be exposed to the hazardous material, because already the patients who already the individuals who walk into the hospitals are patients with certain kind of disease condition or infection. But when they are exposed to the hazardous materials that are in the hospital, or the hazardous generated waste that is in the hospital, obviously their immune gets compromised, and then they fall prey for many kind of infections which can't be untreated. The state government to provide land for setting up common biomedical waste treatment and disposable facilities. So the government has made sure that the final dumping of the waste generated from cities or towns should be almost 25 to 35 kilometers away from a village or an habited area, so that people don't fall sick, or the habitation or the resources are not getting contaminated. All healthcare facilities shall make available the annual report on its website within a period of 2 years from the date of publication of the biomedical waste management rule. So, and also it was mandatory, that all the institutions, organization, home settings, everything should make sure, means should follow the rules. Now, as you see, after no, Modi became the prime minister. He brought in many schemes, and he also launched many programs pertaining to the safety of cities, towns, and places, not to get exposed to the hazardous materials by segregating waste and by proper disposal of waste. And also certain rules were made mandatory to be used by every household living in the country, so that they segregate it properly, and no, make it easier even for the biomedical waste handlers to finally dispose it. So now we can see people coming asking, the municipal people asking you to segregate your waste, dry waste and the wet waste, so that it is easy for them to finally dispose it in a proper manner. It can be through controlled tipping, it can be through incineration, it can be through dumping, or by using this manure pits. So whatever it is, it makes the work easier for people when segregation happens. Then work practices and behaviors to prevent occupational hazards in hospitals. So hospitals have many unique hazards that can potentially affect the health of employees. These hazards include biological, chemical, ergonomic hazards, hazardous drugs, ionizing and non-ionizing radiation, shift works, stress and violence. So anybody has idea, or do you have any idea about ergonomic? What is ergonomic? Do you know the meaning?
Ergonomic means it's work at workplace, ma'am.
It's yeah, very close. Thank you. So it is nothing but fitting into the job. It's called ergonomic. So fitting into the job. Uh, so to give you an example about it, uh, people who are uh, okay, so people who have a very less or a compromised immune system. So people who have a compromised immune system immediately fall sick, and they cannot work in a place. Though they have the caliber of work, they cannot be exposed to certain kind of environment where their health gets triggered. So ergonomic hazards is nothing but fitting into the job where they can do their job without getting exposed to certain kind of materials or certain kind of scenarios where their health gets deteriorated. So one of the root causes of workplace injuries, illness and incidents is the failure to identify or recognize hazards that are present or that could have been anticipated. So the main root cause is occupational related injuries. Sometimes stress causes sickness. Sometimes dealing with the patient suddenly leads to some kind of mishappening between the patient and the staff. So all this causes a kind of restriction in doing their duties and activities. To identify and assess hazards, employers and workers should collect and review information about the hazards present or likely to be present in the workplace. So, whenever a person walks into a profession or wants to do a job in a particular department, so he should also be informed about what will be the threats, what will be what will be the hazards he will be exposed to, and also at the workplace, uh, inspections should be done to analyze the level of hazards that would take place, and to see that the hazards are controlled and there is no reoccurring of hazards, and monitor the employers who are working in an hazardous area, and see to it that they are not exposed to a situation where they get injured, they developed illnesses, incidents, or they land up into long-term diseases. The best example I can give you for occupational hazards is people who work in factories, people who work in cotton industries, fabric industries, no, people who work in churning this what you call sugar cane, field of sugar cane, coal mines, and are heavily exposed to dust, are at risk of developing occupational hazards, wherein when they work in the factories, the smoke emitted from it, or the fibers or the minute dust particles that are emitted from it, they go and get settled in their lungs, leading to respiratory problems or COPDs. Okay, fixing hazards on the spot emphasizes the importance of safety and health and takes advantage of a safety leadership opportunity. So any hazard, if it is fixed prior handedly, people will not get exposed to it again and again, and also they'll be very much cautious when they are doing work, and also conscious in taking or making decisions. Then, to effectively control and prevent hazards, employers should involve workers who have best knowledge and understanding and who can prevent hazards, then fall or no, get injured or develop illnesses. Identify and evaluate options for controlling hazards using a hierarchy of controls. Use of hazard control plan to guide selection and implementation of control, and to do it according to the plan, especially people who work at the construction sites, or people who to talk about medical profession, people who work with high risk patients. Okay, like patients with hepatitis, patients with HIV, TB, MDR, TB. So these people should be very much vigilant and should know their limitations of providing care by not getting exposed to the microorganisms or the microbial agents that cause infection. Then develop plans with measures to protect workers during emergencies and non-routine activities, and then review new technologies for the potential to be more protective, more reliable, or less costly. So it's nothing but a person should have good knowledge about the technologies also, wherein the smartness he should use in not getting exposed to the hazards, and the hazard control plan should include provisions of provisions to protect workers during non-routine operations and foreseeable routines. It means there should be a what you call a protocol that should be given to people when they are working in a hazardous zone, so that they'll take measures not to complicate situations, and also the routines to be followed in preventing and maintaining practices, and also making sure that the hazardous situation doesn't directly or indirectly affect both the employer and the person who is getting the care. Next one is ergonomics and employee safety. So ergonomics and employee safety, as I said you, ergonomics is a science of fitting into the job. So ergonomic uh, make sure that person whoever is doing job doesn't develop any kind of risks or loses his physical capacity of doing his work. For example, if you see nowadays, uh, you know the software companies, people uh, have to work on their system for a longer period of time, right? So they continuously sit for longer period of time, wherein they started developing spinal problems. Okay, and also people who stand for a longer time started developing varicose vein, etc., etc. Okay, so now what they are doing, especially in the software companies, they have this ergonomic chairs. This ergonomic chairs are nothing but they give them a better way to sit. Means even if they sit, none of the part gets pressurized, and there is no much pressure on the spine. So after the class, if you find time, please go open your Google and check for this ergonomic chairs and ergonomic equipments, especially for people who sit for a longer time, or ergonomic chair for office workers. If you see, there are certain kind of chairs that are what you call customized in a way which doesn't make a person get tired, and also it helps them to relax for a bit of time and again get back to their work. Okay, and ergonomic disorders are the fastest growing category of work related illness. So whenever the person doesn't get his comfort zone in his work, obviously he is falling in a category of developing multiple illnesses or sickness. Major ergonomic issues in the hospital settings include patient handling with awkward postures. So if proper posture is not maintained, as I have given you an example, if a proper posture is not maintained, person will end up developing musculoskeletal disorder. A street sweeper will end up developing musculoskeletal disorder. The same way, any hospital setting or any workplace, if there is no proper body posture maintained, person will start developing deformities and dislocations. So, to help avoid healthcare worker injuries, employers should ensure workplace analysis to identify and correct workplace hazard and exposure to ergonomic stressors, injury recording and analysis to identify and correct workplace hazards and exposure to ergonomic stressors. Then injury recording and analysis to identify injury patterns, allowing visibility to correct unforeseen risks. And fourth one is all employees should be appropriately trained in order to properly use equipment and ergonomic knowledge. So keeping in mind of health workers, so I'm again using the same example. So when the research was done on street sweepers, and when they were monitored doing their work, it was identified that they used to do their work bending for longer hours, or they used to stand in one position and do work for longer hours. Okay, for example, while brooming, they used to bend for a longer period of time. While segregating waste, they used to stand for a longer period of time. And the third one was they were exposed to hazardous material and they were not using PPE. So when they were not using it, they fell prey for many respiratory infections. And second thing, to deal with the whole hazardous material and so foul smelling what you call material, to foul smelling material, they used to get the which they are habituated to consuming alcohol and chewing tobacco, which causes oral what you call oral uh, no the risk of developing oral cancers, and also the risk of developing
Infections, cancers.
infections in the oral cavity. Thank you. And then also after that, because of not using PPE and not doing proper hand washing, they also fell in the zone of developing recurrent infections and having the history of having diarrhea, vomiting. And as I said you, as they were continuously bent while brooming, they had severe knee and back pains. So when all this categories were analyzed, so there was a conclusion made that among that 100, as 89% of them were at risk of musculoskeletal problems, among that 89, only 55% of them uh, had the potential of coming back to normalcy, whereas the other 25% were completely at risk of dislocations, developing of osteoporosis and osteomalacia. So when proper education is not given, when proper body mechanism is not maintained, when they are exposed to hazardous material, it's not only one system getting affected, it is the entire body getting affected, and it is like giving a chance of developing multiple complications or multiple infections. Next, moving on to the role of hospital administrator in prevention and management of occupational hazards. So, after discussing about all this, what do you feel, and what should be the role of an administrator in preventing occupational hazard? For example, you are an hospital administrator and you find your staff standing for longer hours, lifting, shifting patients, lifting heavier objects, what will be your call as a hospital administrator in making changes? Yes, anybody? Should I repeat the question?
Yes, ma'am, please.
So if you are a hospital administrator, what will be your call on resolving this occupational hazard? If you see your staff standing continuously for longer hours, not taking a break, lifting of heavier objects, shifting of patients, helping in shifting patients, or struggling to change positions of people who are little hefty. So what will be your call, and how you will no try to reduce the risk of occupational hazards in among your staff? Because you cannot tell them that don't do, because there is nobody else to do that work. But how can you help them to resolve for means developing complications?
Ma'am, in case of standing for long
Ma'am,
hours,
workplace modification,
Workplace modification means, can
like
you
uh, like if you already given an example of this chair, which is modified accordingly, and
but
for lifting heavy patients,
hmm,
maybe they can take the help of another, not the single person doing, two people doing, and
okay.
also teaching the staff some physical exercises which will improve their strength,
Hmm,
and also
okay.
teaching positions in which they'll not hurt their back,
Okay,
or
means teaching
shifting
them about
procedures,
maintaining body mechanics.
how to
Okay.
transfer body
Okay.
mechanics.
Okay.
And the safe transfers also, there are a few mechanisms in which if you transfer the patient, there's not much load on the person
Staff.
who's doing that.
Okay. Okay.
Yeah, yes,
But
like that.
I'll not be able to agree with your first statement, which was about ergonomic chair, because staff will not have that possibility, because none of the hospital maintains nurse and patient ratio wherein no one nurse one patient. So one nurse will be handling 6 to 7 patients at a time in few situations, or compulsory she'll have 3 to 4 patients, so she'll not have the time. So only the thing we can tell her is to maintain, as you said, maintain proper body mechanics, as well as take a little break often, stretch, do stretching exercises which will help her not
Break
to develop
stretches.
strain, and also use
Yes.
certain kind of techniques after going back home, like soaking feet in hot water because they stand for a longer period of time, which can improve circulation, putting a pillow under the lower extremities so that the circulation happens properly, and the chances of developing varicose vein will be less. Yes. So anybody else want to tell something?
ma'am, they can also introduce programs where they encourage all the nurses or staff members to do yoga and meditation that can be organized in the premises of the organization itself.
So that can happen only once in a while, right?
At least twice or thrice a week can benefit them. And as long as they're learning the postures correctly in the organization, they can practice it at
Yes.
home also.
Yes. 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 Okay. So that's all.
And also, if
Ma'am,
possible,
like you
try
said,
to give
there's
some.
a risk of risk of varicose veins. So calf muscle stretchings are important for them, ma'am.
Yes. Any kind of stress exercises will help them to resolve or remove, means what you call, prevent pressure on certain means the peripheral extremities especially. So that's all.
And also
Yeah.
supply them with some small stools or chairs, ma'am, where whenever it's possible for them to just sit down for a couple of minutes, breathe in, and then just go back to work.
Yeah, okay. Yeah, fine. That can be the internal modification done, but it cannot be mandatory for everybody. But should make sure that certain things are there for them, so that they don't land up into complications, because they are the people who have to give care, provide care. If they fall sick, then the delivery system, healthcare delivery system will be affected. So generally the role of, thank you so much. Getting back into this role of the hospital administration in prevention and management, as you all said, certain kind of rules, certain kind of techniques of coming out of stress, practicing some exercises, and reducing the exposure to the hazardous material. If such kind of things are done, then no, the staff is also not at risk, and the patients are also not at risk, and the job satisfaction level of the staff will be improved, and she or he will also show much interest in doing their duties uh, by giving deliberate care. So the same thing is over here. So this was all about your second unit. So I'll be summarizing it again for you all. So to summarize, we have started occupational hazard. What is the actual meaning of occupational hazard? And we have seen about what are the agents that cause occupational hazard, and what are the high risk areas that lead to workplace violence. And whenever the what you call areas of hospital that has hazardous material, if people come in contact with it, or if they are exposed to it, they would land up into one or the other problem. And what is workplace violence at hospitals, how it can be resolved by checking on the staff. So the administration should check on them, and should make sure that they are not getting exposed to this physical assaults or any kind of assaults that happen in the work area. And we also saw about what is biomedical waste management, its protocols, segregation, and we have also discussed about role of administrator in preventing occupational hazards. So I hope I was clear, and if you have any doubts, you can ask me. Then we'll close the session. Any doubts, or should I repeat any content? So if you want me to repeat any of the subtopic, I'll do it for you.
No, ma'am, it was clear.
Yeah. Okay then. So I'm ending the session. Have a good day. Bye.
Thank you, ma'am.
Thank you, ma'am. Good night, ma'am.
Okay, students, for today class. Take care.
Thank you, Sukumar sir.
Thank you.